Welcome, everyone. So what have we been doing? Well, there was a pilot project in July of last year which attracted 100 respondents. That was a sort of useful first stage and was then amended. And then the full online survey, which is the bulk of the project, was launched last December and ran until March. And that has had around 500 responses. And then we've also provided a qualitative element, which was from the Philippines in March as well, with Filipinos in Cebu, and they are cruise ship workers. So I'm not saying that this is a study that says all you need to know about women seafarers. It certainly isn't. But what it is a very useful addition to the literature. I mean, there isn't a huge amount on women seafarers. A lot of it is outdated. The ILO book I cited there is more than 10 years out of date. Well, I say out of date, it's still valid, but we really need new figures, actually. So this is part of the process, like I said. And what it does is raise some issues, which is sort of what we're here to talk about. So I will come on to those. But before I do so, let me talk about who actually responded to the survey. As I said, it's not exactly representative, but it's still valuable. So we have quite a young demographic. Nearly 3/4 were under 40. We had, as I said, quite a few from the UK, so a lot from Northern Europe, and then quite a lot from the Philippines. But I think 50 plus countries were covered overall, represented in one form or another. So the big question we asked really was, please let us know what the big issues are for you in terms of health. So respondents were asked to select 3 areas, and we've had to group some together. And as you can see, we've covered a lot of different topics in one small survey. So with all those caveats in mind, the big things coming out of this are joint and back pain. And then the second is psychological issues. So obviously stress and anxiety and depression aren't necessarily the same thing, but for our purposes we group them together. And then we have a number of other sizable ones. The one, I apologise that some of the graphs have been cut off, the grey bar is just saying that I do not have any health issues. So that's encouraging, that's nearly a quarter, but it may not actually be valid. It depends, means some people may not want to be disclosing any sort of health issues. So, you know, we can only take this so far. But that gives you a sense, I think, of what the concerns are. So what can we take from this particular question? As I said, the 2 ones that really stand out are those 2. We found that joint and back pain was more of an issue for those working on passenger and cruise ships. On the cargo and tankers, we found that it was more psychological issues. Ratings, perhaps unsurprisingly, suffering from joint and back pain more. And then there's some other big issues, so overweight and obesity issues, slightly higher in the older age group, menstruation issues, and as I said, an encouraging quarter not having any issues whatsoever. Then, interestingly, we said, is this related to your work? And more than half said yes. But what we didn't do was say which issues are specifically related to your work. So you can't take this beyond what I've done here, which is to say that 3/4 of those who said they had back pain or joint pain said one of their issues was related to work. So, if you see what I mean. So headaches, also many of those related to work, that may not be specifically headaches. Does that make sense? And so on. So the focus groups, as I said, were with cruise ship workers from the Philippines, and they said yes, back pain is a big problem, joint pain, and that's because of heavy trays, things perhaps, I mean, I certainly hadn't thought of, maybe for other people it's obvious. If corridors are too narrow, you can't use a trolley, so you're carrying really heavy trays. If there's only one galley on a ship, you're carrying heavy trays up escalators, in elevators, down narrow corridors. It's pretty heavy work. Carrying luggage to cabins, carrying heavy bed linen, and having to change beds, many beds in a short period, is extremely strenuous work. So it's not so surprising that back pain is an issue. Then we asked whether there were any issues that prevented people from accessing healthcare. Again, I'm sorry about the slides here. The third down says concerns about a lack of confidentiality. The next one is don't know how to find a doctor. Thank you. The fear, lack of confidence in medically trained personnel. Then fear not ready to face one's health needs or problems, rather. And then I don't know what my health needs are. As you can see, quite a few people feel that there's nothing preventing them getting the health care that they need, which is great if that's true. On the flip side, more than half said that there is an issue that stops them getting the health care they need, and the main one being concerns about lack of confidentiality. So that's something we need to be thinking about. I think also concerning is that people, certainly in some sectors more than others, have a lack of confidence in the medically trained personnel on board, which I think is a concern too. So if people did say they had problems, if there were issues that stopped them accessing healthcare, we also asked, well, what would help you to overcome those? Some of these are the same really as those selected on the survey. People were saying it would be good to be able to see a doctor whilst they're on duty, certainly having access to both a female doctor as well as the male one would be helpful. Job security was an issue that came up, that if you were diagnosed with a particular problem, would you be rehired? And if you don't have confidence in the medically trained person on your ship, for example, can you then access a second opinion from someone who you do have confidence in on land? So then we said, what types of health information or services or screenings would help you stay healthy and meet any challenges you have? And by far and away the most popular was having a routine wellness check system in place. And then secondly, nutritional information. But in the older group, there was a particular request for quitting smoking and weight loss information after routine wellness checks. And we also asked focus group participants to talk about what they understood good health to mean. And it's quite varied actually. I mean, part of it is just not being as tired as they felt, so having a proper day off, having enough privacy in a cabin to be able to rest properly. If you're on an old ship with, say, 6 people sharing, it's very hard to have enough quiet to actually get the rest you need. Part of it was also about having enough stimulation, so not just recreational facilities, physical recreational facilities. And it's interesting that Zumba and yoga have come up, because that's not the sort of thing we traditionally offer. But also film screenings, I know that may happen on long ships already, but having that sort of richness of life that perhaps we don't cater for at the moment, and how that feeds into physical well-being as well as mental well-being. Women's support groups, alcohol in moderation, that's an age-old issue, which relieves stress and helps socialising. 40% of respondents don't currently have access to a way of, specific to a sanitary bin. What we don't really know is the details of how this sort of process does work and how it might be improved. But officers are far more likely to have access at 53%. And if you're working on a cruise ship, you're pretty much certain to have a system in place that makes this a discrete practice. And then that percentage decreases across these other sectors. And then moving on to sexual harassment. In our pilot study, I don't think we were surprised, I don't know if we were or not, but we had 50% rate of responses saying that sexual harassment had been an issue currently or in the past among the respondents. But this then fell to 17% with this much larger survey, which is laid out in the full report. We've also got an article in the International Maritime Health Journal. So should you be wanting more information on how different figures cross-tabulate with nationality or age, it's all there.
Thank you very much. My name is Jacqueline Smith. I'm the ITF Maritime Coordinator. I have almost been in my job for 1 year. We believe that the findings need to be discussed broader. They're not, as I said, there is a snapshot. We can't take this as this is what it is and we have all the answers. This is a snapshot, and then I think there needs to be a focus potentially on specific issues that you would like to, that would need to be highlighted. When you talk about sanitary disposals and how that could be done, I don't think it's really all that complicated, but on the smaller vessels, of course, to have a bin, if you might have one woman on board or might not, that might be something that and I'm sure Natalie can touch on this later, something that the company wouldn't invest in. But then, of course, you have places where there's just plastic bags or there's just paper bags that could be available. So, you know, it really does depend on where there would be a majority of women. Then, of course, you need to have proper facilities because then you will have more need for the sanitary disposals. So this survey, of course, will be discussed, and I think we do need to, at least from my perspective, we would need to identify where we want to put the focus on so we don't just spread ourselves thin on looking at everything as if one size fits all, because it doesn't within Maritime.
Thank you very much, Jackie, for that overview.
There is one issue which was not mentioned in the survey, it's a pregnancy. But taking into account that there is a young females which is sailing, there is pregnancy, it's an issue. During the survey, as far as I know, only 2 ladies mentioned. And it was a problem because one was fired the moment the company found out that she was pregnant. And she was on the contract. So she lost her income for 9 months, and then the income was lost also for the postnatal period. So it's quite hard for the people, you know, for the ladies who's bringing income to the families. We have a clear definition in IMHA guidelines. So the female seafarer can sail till 24 weeks of pregnancy, non-complicated pregnancy, because the pregnancies can be really difficult. To be frank, I was flying to almost 40 weeks, I issuing certificate by myself, but it was okay and I felt good. There is another ladies who is hardly moving. So 24 weeks, not 36 like in the air companies. And the pregnancy should be declared in the beginning. Quite a lot of, especially the cruise companies, they require the pregnancy test. But there is quite a lot of questions, like, you know, we doing the pregnancy test, it can be the beginning, if the sexual course can be immediately after the visit of the doctor. So we have to encourage lady not to lie and to tell it in the beginning, but from the other side we have to be sure that if she will tell the truth, she will be protected. So this is the rest of the guidelines. So we can try to let the female sail till the later period in the coastal area when it's non-complicated pregnancy and there is access to the risk of hospital quite soon. Thank you.
But what I'd like to do now is to take this into a slightly different context. And Caitlin, perhaps if you can get the next slide for me. The IMHA conference, which met not this year but the year before in Bergen, I produced a paper to do with seafarers' medical examinations. And for that, I asked my colleagues at the International Group of P&I Clubs for some of the statistics that they kept rather close to their chests and hidden about the main reasons why seafarers were actually failing their PMEs. Now, for those of you who don't know, a PME, as I was mentioned before, is a pre-employment medical examination. So what were these actual things? And as you can see, we've got two columns here. We've got the Philippines and we've got the rest of the world. And the reason I raise this is, if you look at these particular issues, this population is both men and women together. So it's not specifically for men, it's total populations. And it's based on the claims that actually go to the P&I clubs. That by looking at a specific issue, we can actually try and turn that situation around so we can get, as you said, more wellness on board, better employment conditions, it's of benefit to everybody. So I try to look at the bottom line. But if you look at these particular issues and you look at the Philippines vis-a-vis the rest of the world, firstly you'll find that there are slight differences in the rank ordering of the problems, but actually they're quite similar. But if you then take that and you take to the next slide, Caitlin, to the issues as identified by the study for female seafarers, you'll see actually the issues are somewhat different. Has anybody got any rationale for that? Yeah?
Well, I would think that if those are the issues identified by the pre-employment medical, they're not the people who are on board. These are the people who are on board.
Possibly.
So possibly if we ask, let's say, the same population of male crew, they'll come with back pain and things like that as well, because they're carrying the trays as well.
That's possibly, yeah.
Is it to do with the fact that the PM is looking at illnesses which are going to affect you actually being able to do your job, and stress, anxiety and depression aren't necessarily going to stop them doing that, so they're not going to be dragged up in their heels?
I think it's partly that. I also think it goes back to this whole concept of male machismo and culture, and a willingness of men to actually admit to having more psychological illnesses. If you like, the men talk about having back pain, they talk about perhaps the consequences of stress. The women are perhaps talking more about psychological factors, and they're talking about possibly headaches and other sorts of manifestations. I think actually you'll probably find that if you change your culture, you change your working environment, you change your relationships on board, and you do all these sorts of things, you can actually see a demonstrable benefit, if we go back to the previous slide, sorry Caitlin, in some of those other things as well, because perhaps you get less ulcers, you're more likely to get certainly less hypertension, I think. You're less likely to have some of the psychiatric disorders that have been talked about. And I see you nodding your head as a medic. But so I think if we try to move away from this idea of men and women and look at what is the ideal working climate that we want to have on board our vessels, that everybody, irrespective of gender, irrespective of their sexual orientation, irrespective of their religious belief, what's the ideal culture on board which can make everybody feel part of that team? And if we can get that culture right, hopefully we can then move to more of a wellness culture on board. I know that I'm a trustee of Sailors Society. Is Alice here?
Yes.
Hi Alice.
Hi.
Alice has done some wonderful work in promoting a wellness project which Sailors Society is starting to actually look at, because this is a bigger issue generally about really recognising the value of wellness at sea. So I'm not knocking the work, because I think this has stimulated a very good debate, but actually I think we need to take it up one level and say, what is the ideal environment that we want everybody to work in, and how do we get there? What do we need to change? What are the inhibitors at the moment, and what are the cultural blocks that we can put in place? And how can we perhaps move to an environment where people feel comfortable about talking about these issues? Do we need some mentors? Do we need some union bodies? I don't know. I'm open to ideas. And if we truly want to be effective, and we want the MLC to work, we're going to have to look at creative ways to make that happen. Thank you very much.
There are a number of next steps that we've come up with as a group. The first is the production and distribution of gender-specific information on these 4 areas: back pain, on mental health, on nutrition, and on gynecological complaints. It would be great also to see a solution for the disposal of sanitary waste across the board. And also, as has been raised by a number of respondents, actually, the ability to access female-specific products, whether that's tampons or femidons or different, things that aren't currently stocked in port shops and in welfare centres. So there are some quite small practical things that could make a difference here. We'd like to see further investigation of sexual harassments, and then I put these together, but they're not connected, and also this concerning lack of confidence people have in their medically trained personnel on board, and whether that's just a question of educating and reassuring, or whether there is actually an issue there. But it's a problem if people aren't asking the questions they need to ask to stay healthy because of it. And then the final point isn't a point in itself, it's just a recognition that obviously any health intervention needs all stakeholders' engagement and support, including that of seafarers. And there are a few more steps. We are keen to see manning agents and owners develop clearer policies where they don't already have them in place on medical confidentiality, on sanitary waste, on the management of stress and other, particularly the minor mental health issues that are so common, and the practical measures that relate to them. So we know that exercise and we know that recreational facilities are very effective in managing mild mental health conditions. So having policies in place to support this would be extremely useful. And then to develop this research, I mean, there are a number of possibilities, but it would be certainly useful to have more data, not only on women seafarers, as I said, but to be able to compare this health data on women seafarers with more health data on men. I think that's possibly something Natalie will start to talk about. And as I said, this has been inevitably a somewhat superficial exercise, although a very useful one. So there's a lot of scope for much more investigation of specific issues, sexual harassment being one of them, but there are a number of others as well.